So, you have an endoscopy or a colonoscopy on the calendar, and you've probably been given a whole stack of instructions. We're going to clear up one of the most common and honestly most confusing parts of that prep: what to do with your daily medications.
Look, it's totally normal to feel a little bit anxious about changing up medications you take every single day for a good reason. But you don't have to worry. We're going to walk through this whole process step by step so you can go in and have a really confident conversation with your doctor. Okay, let's dive in.
First up, let's get right to the why. Why are we even asking you to do this? Well, we don't just stop medications for no reason. Every single decision is a really careful calculation. It's a balancing act between two potential risks.
Think of it like a scale. On one side, you've got the risk of bleeding during your procedure. If we find a polyp and need to take it out, certain meds can make that bleeding a lot harder to control. But on the other side of the scale, there's the risk that comes from stopping a medication that's protecting you from something serious, like a blood clot or a stroke. So the main thing to know is that your medical team is always weighing these two things to make the safest possible plan just for you.
All right, let's tackle the big one, the category that causes the most confusion: blood thinners. This is where most of the questions come from, but I promise we're going to break it down so it's super simple to understand. Let's kick things off with some really good news. For the vast majority of people, that daily low-dose or baby aspirin you take for your heart, you can usually just keep taking it right through your procedure. It's considered a very low risk, so that's one less thing for a lot of you to even worry about. Now, for other common antiplatelet drugs, like Plavix, the generic is clopidogrel, the plan is a little different, especially if there's a good chance your doctor might need to do something like remove a polyp. So as you see here, the conversation really starts about a week out, and typically you'll be asked to hold off on taking it for about 5 to 7 days before. That just gives your body enough time to clear the drug out, which really lowers the bleeding risk during the procedure. Okay, I need you to listen very, very closely to this. This is so important, I can't stress it enough. If you have had a heart stent put in recently, stopping your antiplatelet medication could cause a catastrophic clot to form inside that stent. I mean, it's a true medical emergency. So you should never stop these medications without getting the green light from the cardiologist who manages your heart. Seriously, no exceptions on this one. Okay, moving on to another really common blood thinner, warfarin, which you probably know as Coumadin. Because of how this one works, it just takes a bit longer to wear off. So the standard plan is to stop it 5 full days before your procedure. Now, for some people who are at a really high risk for clotting, your doctor might use a temporary, short-acting injectable blood thinner. We call that a bridge, to keep you protected during those few days. It's a very common and safe way to handle it. And this shows the plan for the newer generation of blood thinners, the ones we often call DOACs. Look at how much shorter the hold times are compared to warfarin. For Eliquis and Xarelto, we're talking just 2 days. For Pradaxa, maybe 2 to 3 days. It's really important to know, though, that these times can change a bit depending on how well your kidneys are working, so your doctor will nail down this exact timing for you. Okay, let's shift gears. We're moving on from blood thinners to another really critical group of medications, the ones for diabetes. Here, the balancing act isn't about bleeding. It's all about keeping your blood sugar in a safe range while you're fasting for the prep and the procedure. So here's the general game plan. For meds like Ozempic, we hold them because they can slow down how fast your stomach empties, and that can be a safety issue during anesthesia. For your other diabetes pills, you'll pretty much skip or take a smaller dose on the day of the procedure, since you won't be eating. But here's the key. Use your home glucose meter. If you check and your sugar is running a little low, go for clear liquid with sugar, like apple juice. If it's high, stick with water or broth. You're really in the driver's seat here. Now, not every medication change we talk about is about bleeding or blood sugar. Sometimes we make temporary changes for a completely different reason, to help you get the absolute best, most effective bowel prep possible. Just think about it for a second. The whole goal of the prep is to get your colon sparkling clean so the doctor can get a crystal clear view. Well, medications that cause constipation, like opioids or certain other drugs, are working against that goal. So especially if you've had a tough time with a prep before, your doctor might suggest pausing these for a few days. It can make all the difference in getting a great result this time around. And before we wrap this up, I want to share one final pro tip. This is a simple, over-the-counter thing you can do that can make a huge difference in how good your exam is. It's a medication called simethone. You might know it by the brand name Gas-X. It's just a simple, safe liquid that breaks up all the tiny bubbles and foam that can form inside the colon. Adding this to your prep is kind of like cleaning a foggy window. It just lets your doctor see everything, even the tiniest little polyps. It's such a small step that can have a really big payoff. So we have covered a lot of ground. But the most important thing to take away from all of this is that every single patient is unique. Your health history, the exact meds you take, and the procedure you're having, all of that gets factored into your final instructions. This guide is here to give you the background, to give you the why behind that plan. So now you have the framework to understand why these changes are happening. You know the most critical safety points to watch out for, especially with heart stents. The whole goal here is for you to walk into that conversation with your doctor feeling prepared, feeling empowered. So, are you ready to team up and make that plan together?